Marcus, thanks for that. We've heard of AREDS2. Do you mind telling us a little bit more about AREDS2 and its relevance to AMD?
So AREDS 1 and 2 are two very big studies that have been conducted to look at the impact of dietary intervention on the progression of AMD. AREDS2 is based on around 4,000 people and has studied them over 5 years, and they were split into different arms and they received different types of supplements. So there's control groups, and then there was one particular arm of around over 1,000 people that have received supplements that contained lutein and zeaxanthin. Based on the conclusion from this AREDS study, it appears that at least in people with where there's already an early onset of AMD, supplementing via the diet, lutein and zeaxanthin can reduce the risk of the disease becoming worse. So the progression of the disease the risk of that is reduced. So it appears that this particular supplement is beneficial in avoiding getting the disease of the disease getting worse. We don't have conclusive data about what this type of supplement does in perfectly healthy people, and nobody knows that. So regarding this, we can just hazard our best guess and look at the scientific rationale that would guide us in if we want to do something about avoiding the risk of AMD. And I would say it makes sense, considering the fact that it slows down AMD in people who already have AMD, but also considering some of the mechanisms which we think play a role in AMD. It would make sense to consider that this particular supplement is a good option to prevent AMD.